Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today I'm at OU Physicians in Tulsa at the Schusterman Clinic, and joining me to talk about pelvic floor dysfunction is Dr. Spiros Marinos. Welcome to the program.
Nice to have you.
Now, before we start actually talking about our subject of pelvic floor dysfunction, you're also the Chief of Gynecology and also of Urogynecology here at the Schusterman Clinic at OU Physicians in Tulsa.
Correct.
Now, tell our viewers exactly what is gynecology and then what is urogynecology?
Gynecology is one half of our specialty, obstetrics and gynecology, and deals with everything that has to do with a female pathology, with the exception of babies.
Okay.
And then the urogynecology is the most recent of the 4 fellowships, subspecialties we have in our field, and that was found to necessitate an extra training of at least 3 years in order to be able to take care of women with pelvic floor dysfunction.
Okay, now with gynecology, when you talk about the routine physical kinds of things for
Correct.
women, so we're talking about for people that are males and may not know, we're talking about pap exams.
Pap exams, abnormal bleeding, contraception, problems with infection, problems with abnormal discharge, pain.
Okay.
This kind of benign gynecological problems. This is the general gynecology field. And then when it comes to have problems with pelvic floor pathology, like prolapse, means herniation of the internal organs, like problems with voiding, either incontinence or not being able to void or having to go all the time, problems with defecation, not being able to go because you're constipated or having to go all the time or losing control of your bowel movements.
Okay.
For example, women who have problems with chronic pain that cannot be solved from the general gynecologist, women who have problems with congenital defects, they were born with septums, means obstruction of their vagina, or abnormalities in their external organs, or even lately, women who want just to beautify their external organs. These are fields that have to do with the field of urogynecology.
Okay, now if a person was having problems with their ovaries and feeling that there may be a problem there, wondering about ovarian cancer or anything like that, or those that may be wondering if they need to have a hysterectomy because of some of these problems, are those going to fall on the gynecological side or on the urogynecological side?
They are on the side of the gynecology, the general gynecology, and everybody who has been trained with the 4 years of training of general OB-GYN, means obstetrics and gynecology, is more than eligible, more than competent to take care of that. If now the patient has problems with relaxation of the uterus, the muscles of the pelvis, the bladder, the rectum, and these are beyond the scope of the capacity or the training of the general gynecologist, this is where we come as urogynecologists.
Okay. Now, how young are we talking about? Because we talk about young adults, young women having pap smears very early. How young are we talking about this field of gynecology where the woman should see, or the young lady should see a gynecologist as well as the urogynecologist?
Every woman has to see her gynecologist as soon as she becomes sexually active, and definitely no later than when she becomes 18 years of age, and also if she does not have her periods all the way up to the age of 16. She has to see a urogynecologist, either being self-referred or having complained of the problems that we mentioned to her family medicine doctor, to her internist, to her general gynecologist, and having asked for a level of expertise that cannot be given by a general gynecologist. For example, there was a study just published last fall in the Journal of the American Medical Association, where they found that if you take every single woman in the United States between the age of 20 and 65, and you see by age groups what is the prevalence, means how common it is to have this kind of problems that we deal as urogynecologists, they found that overall 20-25% of the women, 1 out of 4, if you ask, are going to have serious enough of a problem to require a visit to a physician, preferably a urogynecologist, and maybe either conservative or surgical treatment. If you take the women who are more than 45 years of age, you go to 40%. And if you take women who are more than 65, almost 60% of them, 6 out of 10, have this kind of problem. So if you go to let's say, a senior home, nursing home, and you ask every single woman there, about these specific problems, and if you give them the privacy and the comfort level to answer with sincerity,
Right.
at least 6 out of 10, they're going to say, yes, we have the problem, we are bothered, and we would like to know if there is a solution.
Let me ask you this on that, because those are alarming statistics when you talk about the number of women that will be affected at different stages and ages of their life cycle. Are some of these problems because of just the natural process of aging, with muscles relaxing and things shifting and moving places where they were not before? Do genetics play some role in it? Clarify for us.
You nailed it on the head, because there is nothing that goes better with age but only experience. So as you're gonna
I like that one.
you're going to have wrinkles, you're going to have problems with your pelvic floor.
Okay.
Simply, our society has accepted, I hope that this is changing now, as normal part of the told to be a woman or to age to have this kind of problems.
Okay.
So you've been told from your grandma, oh, when you sneeze and cough and you're my age, you're going to lose a little bit of urine, not a big problem. Oh, you may feel your bladder dropping, not a big problem. You have 3 babies. Not anymore, because there's a solution, and women keep being active all the way up to, very old age. They say that today's 40s was, past age 50s, yesterday 50s. So it goes like that. Okay. So the women who have this kind of problem, they have a solution now. What is the reason, you ask me? Multiple reasons. We know for sure one is age.
Okay.
Second, that we know for sure plays a role, especially in prolapse, means relaxation and having our internal organs falling, down. This is how many babies you had and how many babies you had vaginally. So this is a very hot topic, very hot debate, and we know that if you take every single woman and you section every single woman for this purpose, you have to section at least 20 women just to prevent one of them not to have prolapse. So you cannot say that, yes, you must have a C-section, but in our field, 99% of the female urogynecologists have C-sections, if that says something. Another reason is, as you said, genetics. I mean, we know for sure that there are people who wrinkle easier than others.
Right, right.
So these people have propensity to have prolapse easier than others.
Okay.
And then the other thing is what you have been doing in your life. If you are a person working in the Walmart lifting 30 pounds, every 30 minutes, or if you're a postal worker carrying a big bag with mail of 40 pounds every day, you are at more risk of developing prolapse.
Okay, so by carrying heavy objects on a routine basis makes you more prone to the prolapse, this falling down of your internal
incontinence,
organs.
prolapse, all these pathology that we deal with.
Okay.
Also, the same thing is that if you are, let's say, chronically constipated, because constipation is a continuous problem on an everyday basis. Also, if you have problem the way you keep your posture, the way you walk, the way you sit, the way you conduct your everyday activities, you may throw off the balance and then having problems with pain and control of urination and defecation. Okay. Another field that we deal with is something that was a taboo up to a few years from now. It's sexual dysfunction. It's a field that urogynecologists are specially trained to deal with.
Okay. Now, we're going to take a really quick break because I want to come back and ask you some other things in terms of exercising. Does that kind of help delay this? And then we're going to get more into the actual prolapse and this dysfunction so that we understand exactly all of the organs you're talking about and sort of what our symptoms are and even more importantly, what the treatment is. So you stay put.
Yep.
And you stay put. We'll be right back.